Hi, my name is Courtney Smalley, and I am pleased to present our simulation experience, a multi-patient simulation-based program to train emergency medicine residents in the rapid ultrasound for shock rush exam. I'd like to thank my co-authors, Dr. Matthew Costura, Dr. Lauren Moore, Dr. Hannah Saylor, Michelle Feliciano, and Dr. Marina Bushra. Point-of-care ultrasound has become a rapid diagnostic tool in the emergency department to help us assess hemodynamically unstable patients. There is a protocol that can be used called the rapid ultrasound for shock and hypotension exam, and this is a protocol that helps physicians use a systematic approach to determine point-of-care ultrasound findings that are consistent with different types of shock. The objective of our simulation experience was to develop a curriculum for EM residents on the rush exam with three goals: to evaluate the EM resident knowledge of the rush exam, improve the learner's point-of-care ultrasound image acquisition, and to assess comfort in utilizing the rush exam to determine the types of shock. The methods for our experience were that we created a curriculum that consisted of a 10-minute didactic on the rush exam, as well as three 30-minute case-based simulations on three types of shock: hypovolemic, cardiogenic, and obstructive. The EM residents participated in a 1-hour session, and they rotated through three undifferentiated shock scenarios and were asked to perform the rush exam to determine the type of shock. Surveys were administered to our learners before and after the completion of the training to assess their competence. The results of our simulation experience were the following. We had 17 residents participate in the simulation session with a maximum of 3 learners per case. 35% were PGY1, 24% were PGY2, and 41% were PGY3. We gave them a survey and rated their on a 10-point Likert scale. And after completing the training, we found, number one, that our learners had increased confidence pre and post course in the knowledge of the rush exam. Number two, increased confidence in point-of-care ultrasound acquisition. And number three, increased confidence in diagnosing the type of shock utilizing the rush exam at the bedside. Overall, there was an increased confidence in utilizing point-of-care ultrasound to manage undifferentiated shock. What was interesting about our findings is that while all of the groups showed significant improvement, the PGY1 and PGY2 classes demonstrated the greatest confidence by participating in this simulation curriculum. Our conclusion is that the PGY1 and PGY2 resident learners had the greatest improvement in their confidence in utilizing this simulation curriculum and demonstrated the most increase in their confidence. So it may be beneficial to administer this simulation experience early in their training. Our results support a simulation-based, case-based learning experience for our point-of-care ultrasound training on image acquisition and image interpretation utilizing the RUSH protocol. And we demonstrate that they had increased confidence and success with resident learners. Thank you so much for your time.